Say, good morning, all of you post-ops. Good morning, Dr. Rutledge. All right. So we're going to talk a little bit about your experience with the mini-gastric bypass, and just let us know how it's doing. And we have a couple people, Staples, to come out. Laura, how are you?
I'm doing great.
Yeah, good.
I have no problems whatsoever.
Good. Now, you had high blood pressure.
Yes.
And it's getting better?
Yes, it is.
And the latest, though, was a little high day before yesterday.
Mm-hmm.
And we took one dose of your metoprolol?
Toprol, yeah.
Good. And how is it this morning?
It's settled down.
Good.
Back to normal.
Good. Okay, so keep an eye on that.
Okay.
Good. And other questions or anything else that you have that we should answer for you?
Pretty much all's been answered.
Good. Your surgery took about how many minutes?
33 minutes.
33 minutes. You left the hospital the next day,
Mm-hmm.
and not too much pain or trouble?
No.
Good.
Okay.
Okay, very good. And you want to say hi to the camera?
Hi. I'm Debbie Glenn, and I had surgery on Wednesday.
Right.
Everything went well until I woke up Saturday morning at 1 and had some issues under my rib cage and
Issues also known as pain. She's being nice. You know? I'm on the internet. I better not say Dr. Rutledge caused all this pain, right? So you had terrible pain.
and couldn't catch my breath very well, and so that was a concern. Concerning the ports and everything, they've been great. I had one that leaked a little bit the first day, but it sealed right up. They really haven't been painful. But the other issue has taken some time, and it is healing. I can breathe much better now, and I don't know what it was. But
It was me. In other words, that's the surgery. It can cause pain. Laura, you were kind of blessed. You didn't have as much pain. Some people have more pain, some have less. Some because of extra bleeding inside. If you have a little bit of blood in there, that can hurt. Or just you're near a nerve, and it's a raw, cut, stapled edge of stomach, so you can have pain, but it's getting better. Is that right?
yeah, it is.
Good. Okay.
Hi,
Yes.
I'm Luann. I had my surgery on Thursday. I had 7 staples. He said I had a moderately fatty liver. I did have quite a bit of pain on Sunday, and I went to ER like it was on my instructions, and spent a few hours there, and nothing was wrong except I was having a lot of pain, and much more than I thought I could handle.
So you got some pain, intravenous pain
I
medicine,
did.
which is legal. You know, in other words, sometimes patients do great, and it's not your fault or anything. That's something that is actually my fault. We didn't want you to have any pain. You did. We are happy that everything tested out okay.
Right.
And you look pretty good today.
Yeah,
Are you starting to bounce back?
Yeah.
And of course, can we say you're a nurse?
Yes.
Of course, we always give you more pain.
Yes. And actually, I've never had anything in my stomach before. I mean, I've never had any kind of abdominal surgery before, so now I have a whole new
appreciation for your patients.
for my patients, yeah.
Good.
So,
And your surgery lasted how long?
I think about 38 minutes.
Okay.
I have 7 staples.
And you have the 7 ports because you're a little bit larger than our average, and to reach up top with our instruments, we had to add 2 ports.
Right.
But that shouldn't be a big deal. Now we have a star, a VIP, who's back from a year out. Is that right?
That's right. I'm Susan, and I was had my surgery a year ago this week, and I have lost 109 pounds. I brought evidence that I really was a size 28 jeans. This was me.
Oh my goodness gracious.
It's the best thing I've ever done.
We have 2 stories I like to tell, if I may.
You may.
One, a good story, and one kind of a little bit bad story with a happy ending. One is that her father spent many years as a medical missionary, and he's a general surgeon. But he was a general surgeon before they started doing laparoscopic surgery. So I think he was a little skeptical about the surgery, but we invited him in to watch surgery, and he was very complimentary and gave his approval for you to go ahead and have surgery with us. And so we're very flattered by that. And then the other kind of fun thing is that, or not fun, the other interesting point to say is that you sustained a complication after surgery.
Yes.
Okay. Now, about, was it 2 months? A month?
2 months, I think.
About 2 months after surgery, she started to have burning pain. Okay, and kind of indigestion. And so she called us, and right away we gave her treatment for an ulcer or gastritis. And that's gotten better.
It has.
Now, what we have is some patients don't listen. Remember, our number one complication of surgery is gastritis or an ulcer, and she did exactly what you're supposed to do. She called. We have other patients who don't call, and if you don't call, then you can have trouble. So,
Oh, it all worked out fantastic.
great. Good, good, good.
All injections worked.
Good, 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 good. Questions? Anything we should talk about, or
Well, I have my lab results.
So we'd like to look at those.
later.
Yeah, good, good. Anything out of normal that you can remember or anything?
My B6.
Yes, is high.
Yes.
You'll have to turn down your Walmart One Source a little.
Okay. And vitamin A was high, I think.
Then turning down your Walmart One Source will do
No,
that.
that was low. That was low. Phosphates were high.
That can be the early signs of osteoporosis, and you may need to take extra vitamin D.
Okay.
So one of the things that all Americans can get is osteoporosis, soft, weak bones. And that can happen to all of us. It's especially a risk in our patients because we bypass the first part of the bowel where most of the calcium is absorbed. The big hot new thing you may have seen on TV is everybody should take calcium. They advertise Caltrate and Coral calcium, all this calcium, right? Big new studies on osteoporosis suggest that extra calcium doesn't help very much. Some is good, but the hot new area of research is taking extra vitamin D. So you want to work with your doctor. If you didn't get your vitamin D level, it used to be very expensive and now it's much cheaper, and you want to measure your vitamin D. In recent studies, all of us in the United States, a huge number, are vitamin D deficient. And it brings up one other funny little trick of medicine. Remember how we've been told for years to stay out of the sun? That's by the dermatologists who are frightened about skin cancer. Well, now the bone doctors are saying we should get in the sun at least 20 minutes a day because that really helps with vitamin D production. So, go out in the sun.
Okay.
And that will help. And that will help the phosphate. Now, you don't want to go out too long. You don't want to burn, but you want to be out sometime every day if you can.
Okay.
That's new stuff.
That's easy to do. I've got 2 small children who want to go to the pool every day.
Exactly. Yeah. And so it's very interesting. Of course, you remember for years the dermatologists were saying, don't go out in the sun, cover up, stay in the dark, get pale skin. And now we say, no, you want to be out in the sun because increased vitamin D helps your bone, but also protects against colon cancer, breast cancer, and a lot of other issues, muscular strength, falls, hip fractures. So it's huge. A little sun, not too much, don't go crazy, but a little sun for everybody now is on the prescription pad for us. Good.
And do you want me to put on the spot a little bit?
Sure.
I recall you saying that as a woman that I might be put back 3 to 5 years in my progression. I've hit menopause.
Oh.
How is it that I'm hitting menopause now when I thought I was going to be holding that off for a while?
Well, it could be the stress of the weight loss. Now, you have not had a cycle for a long time?
I did it right after surgery, then I started having cycles, and now I've stopped again. And so then...
For how long?
It's been 5 months.
Okay.
And
Well, there are some things that cause...
Work done on that as well.
You did? Okay.
Yes.
There's some things that cause people to stop ovulating, and one of them is weight loss. So, do you mind on public TV to ask your age?
41.
Okay. That would be early, but we do have early menopause in some women. But the weight loss can sometimes cause, you've heard of anorexic, the little gymnasts and stuff like that. When they get real intense with weight loss, they can sometimes slow down or stop their cycles for a period of time. So I would see your gynecologist to ask his advice and also educate me about it, because that's not my area of specialization. But it might be that in another couple of months that'll bounce back once you get over your maximum weight loss.
Okay. Well, we'll see. I'll show you the blood work, the hormone levels that I can.
Good. Did they look like we're in the normal range?
They look like the person going into menopause.
Oh, well, I don't know then. But again, that might be from the weight loss.
Okay.
Yeah. Good. Well, I'm going to move the camera just a little